New at 10, you might know a teenager who's struggling with their mental health. It can be scary if you don't know where to turn. WMTV's Gabriella Rusk sat down with a family in Cottage Grove to talk about the loss of their daughter and their work to educate other parents about how to navigate getting teens the help they need.
She loved to draw, she loved to paint.
A collection of treasured artwork.
She painted this picture. She was so excited to show it to me.
On display at the home of Brian and Julie Elfers.
Just always reminds me of her sitting there and doing what she loved.
Along with her paintings.
She had her ups and downs.
17-year-old Brooke Elfers shared her mental health struggles with her parents.
And I promised her we'd get her better.
At a primary care visit, doctors urged the family to find Brooke immediate treatment.
It was absolutely terrifying. Like, to know your kid needs help and not be able to do it.
After waiting with her in the emergency room, her parents say Brooke decided she no longer wanted to receive care.
It's hard enough for an adult to make a logical based decision on your mental health when you're going through a mental health episode.
Her parents worked tirelessly to get her in to see a therapist.
We tried really, really hard to find one as quickly as we could.
A few weeks later,
Just desperate.
Brooke died by suicide.
We did everything we could think of to do for her, and it wasn't enough.
A friend of the Elfers, Katie Morrow, started Brooke's Brigade to raise awareness about teen mental health.
And if they're in a crisis situation and not willing to accept the help that they need, I'm able to get them the help that they need.
The goal of Brooke's Brigade is to educate other parents how to navigate the state's mental health law.
I want to make sure that it doesn't happen again.
And get their child help, even if the child refuses care.
It's one person at a time, and it can just kind of go from there.
So it's how do we educate people?
Kit Kirstensteiner is the Director of Legal Advocacy Services for Disability Rights Wisconsin.
The important thing is that we find ways to properly educate the parents, the teens, and even probably more so the providers.
The Wisconsin State Statute 5113 gives minors 14 to 17 years old the right to make decisions about their mental health treatment.
If the child will not agree to sign the admission can go ahead on the signature of the parent alone.
If a parent chooses to override a teen's refusal and admit their child for treatment, the law requires a facility to file a petition with a court to review that admission.
It seems like a lot of parents and minors are not getting it, and they're just being told, no, the law won't let us admit you.
At National Alliance for Mental Illness Wisconsin,
it is a complicated issue and not something that's easily solved.
Executive Director Mary Kay Battaglia says emergency detention or calling 911 when a teen is in crisis should not be the only way for a parent to get help.
And that's a very stressful thing for families to go through, is to declare someone's a harm to themselves or others and have to go through that involuntary process.
But it's really startling how many children are struggling right now and not getting the help they need.
A family missing one of their own.
In her passing, she was going to save lots of lives. So we're here to fulfill that.
Proving life is the most precious piece of art.
Brooke loved to help people that were struggling, so that's what we're doing.
There are plans for Wisconsin lawmakers and stakeholders to discuss this issue. A legislative council study committee will review the process for using emergency services to get teens help in a mental health crisis. Council Chair, State Senator Jesse James, says he's hoping to find statewide solutions.
Let's take a look at this big picture, because if it helps improve our youth and we can start at that level, they will have a chance as adults in life, and that's a huge win for all of us.
Now, that committee will meet in August to review the emergency detention process and the civil commitment of minors and draft legislative proposals to bring to the Capitol floor next spring. In the studio, Gabriella Rusk, WMTV 15 News.
And if you or someone you know is struggling, you can always call or text the statewide crisis lifeline. That's 988. Even if you're a family member worried about someone, you can call this number and access resources. The hotline receives about 6,000 calls a month in Wisconsin. We also have a full list of resources on our website, WMTV15news.com.